My name's Greg Dropkin. I'm an activist in Keep Our NHS Public in Liverpool, and I'm going to talk about what happened at the start of the pandemic, at the start of the lockdown last spring. So, one way in which the government failed to respond properly to the pandemic was their delay in imposing a lockdown, eventually announced on the evening of 23rd March and taking effect on the 24th. From the outside, we don't know why they delayed acting on unambiguous warnings. That could only be resolved by interviewing key witnesses and accessing cabinet papers. But we can know something about how the virus was spreading and what the consequences were of delaying the lockdown. In April and May, I used a mathematical model to try to answer those questions. The model was a lot simpler than the one used by the government's advisors at Imperial College, but it gave a very accurate prediction of the number of deaths with COVID recorded on the death certificate. Alison Hill, a physicist at Harvard, had put the model and its source code on the internet, and I learned how to use it. It was a standard model for infectious diseases, developed in 1927, with additional information gathered internationally about the clinical behavior of coronavirus. For example, how long after exposure do people show symptoms? What percentage of people with symptoms end up in hospital? How long does that take? What percentage die? How long does that take? Even with the emerging evidence on all that, in order to use the model to make predictions, you need to know the number of cases at some point in time. But as the pandemic exploded, no one knew how many cases there were because the government stopped testing in the community on 12th of March. People were only being tested in hospital. However, the Office for National Statistics was publishing how many people were dying with COVID recorded on their death certificate. In the early stages of the virus, with no vaccine and no lockdown, the model meant that cases and deaths would grow exponentially at the same rate, doubling in the same length of time. Once the lockdown started, the predictions from the model could be used to estimate backwards how many cases there had been on 18th of March and the rates at which people were infecting others. That may sound like hocus pocus, but it predicted 50,000 deaths by 16th of June, which turned out to be accurate. The day after lockdown started, the head of SAGE, Professor Neil Ferguson, told a House of Commons Select Committee that, quote, fatalities would probably be unlikely to exceed about 20,000, with effectively a lockdown and an intense social distancing strategy, and it could be substantially lower than that. With Alison Hill's model tuned to the UK data, I looked at what would happen if the lockdown had started on 17th of March. An extra 30,000 deaths were caused by 1 week's delay, and you could be 95% certain the number was between 28,000 and 32,000 if the model was right. But how is that even possible? It was possible because cases were doubling every 2.7 days. So after a week, there would be almost 6 times as many. And I estimated there had been around 245,000 cases on the 18th of March. A week's delay at that point in the pandemic meant another 1 million cases. Furthermore, if the eventual lockdown had lasted at full strength, the model predicted only 3,400 active cases in mid-June, unlike hundreds of thousands with the lockdown being eased from mid-May. Others, including Dr. Kit Yates and Professor Neil Ferguson, also came to the conclusion that delaying the lockdown caused tens of thousands of deaths. In mid-March, Ferguson's group at Imperial College had briefed the cabinet, and even if they were underestimating the scale of deaths, they knew what was about to happen and were pressing for a lockdown. Yet still the government delayed. Even though we don't know all the facts, it looks like criminal negligence on a grand scale.